Good afternoon, friends. So this is my topic, key performance indicators in cataract surgery, one of the commonest surgery done not only in India, but also worldwide. So this is the power of data. So when we keep moving, we always keep a watch on the dashboard to see where we are going and how fast we are going. The same way, we need certain parameters to know where we are going and how we are going to reach that area. So you would have heard of this keyword from Indigo, probably one of the, probably only one airline now who's working in India, on time, every time. So how do they arrive at this figure? And they have enough data and they have submitted that data to DGCA, and that has been accepted, and now they are allowed to use this statement on time, every time. This is exactly based on the data they have given comparing with the other domestic airlines. And same way, this is the largest network, and they claim officially the fastest network. Again, the reason is based on numbers, and this number is called key performance indicator. So many industries, particularly the service industries, use this indicator to their advantage, not only for branding, but also improving their quality parameters. So what is this KPI, key performance indicator? Is a measurable value, so that demonstrate how a hospital or organization is achieving a key objective. So basically, we compare KPIs with a lighthouse. So these key performance indicators for surgery, they guide the surgeons through the practice variations. If you see cataract surgery results, it varies between the neophytes as well as experienced and expert surgeons from private practice to NGO hospitals. And same way, adverse outcomes. This again determines the basic KPI, and both provide standardized signals to navigate safely. So the important aspect of KPI is safety, improvement, and also to know where we stand and to prevent adverse outcomes. Right, so we all know cataract surgery is the common surgical procedure, and modern healthcare demands measurable quality assurance. Maybe in the next few months, all your insurance companies and payers will be asking about what is your outcome indicators, and balance of clinical outcome and patient experience is the new key performance indicators. So any objective, we need certain quantifiable metrics to determine the quality and outcomes. So there comes the importance of these numbers. And these are the driving forces, patient expectation. Now all of us know that patients tend to see Google review and give more value to that review than a doctor's long-standing branding or image. And value-based reimbursement replacing volume-based. So far, we've been paid based on numbers, but now we might be shifted to payment based on outcomes, and also professional self-regulation. Now NMC is coming out with so many new regulations that our outcome parameters will also be useful for the next review of our licensing. And also identification of outliers needing support or remediation. So in case a surgeon fails to reach a particular outcome, so he may be called for further training. So these are the common indicators we use, time for initial amount assessment, and these are certain numerical and denominators that really help us to know where our institution or the department stands. And how do we measure surgical success? So many outcome parameters are there. Visual acuity outcome. So some hospital keep it as 612 or better, some hospital keep as 69 or better. And also refractive outcome, whether there is a cylinder with a target within 0.5. And also the rate of complication is again outcome indicator. And PCO rates, few hospitals taken up this as a benchmark for their lens optimization. And surgical efficiency metrics. So previously phaco time was one of the metrics, but now we don't really go and see that. And the outcome indicators, which is really important, and many of the licensing agencies use, is the rate of infectious endophthalmitis following intraocular surgery. This is yet another outcome indicators. Apart from this, now the new age indicator is the patient reported experience measures or the patient reported outcome measures. So patient come with certain complaints, so there may be 5 complaints or 8 complaints, and so if we ask them post surgery, we would have addressed only one complaint of them, that is the visual acuity. But unfortunately, patient doesn't care for the numbers we care for, that is 6.6 or 6.5. For him or her, the overall satisfaction with the entire care experience is more important. The quality of counseling and communication given by our optoms and counselors are very important. The physical comfort that they pass through during the operative period is important. And emotional support addressing their concern, both financial and non-financial concerns, are very important. So the net promoter score here would be whether you would recommend our service to family or friends. So basically we need to go beyond these clinical measures and use certain other instruments like CatQuest or VQual, which are nothing but the names for the questionnaires, and see or ask for the functional improvement for daily activities, independence measure from active patients in terms of driving, reading, face recognition, etc., and also need for spectacle post-surgeries. Apart from the regular KPI, these are the things that are going to be important in the future. So this is a sample study done at our center, and we published the results, patient reported outcome measures in cataract surgery. It's nothing to do with our Snellen based 6.6 or 6.5. This is basically based on checking the effectiveness of quality assurance, as well as the objective indicators here are beyond visual acuity, that is contrast sensitivity, color vision, and the visual parameters that helps in patients' day-to-day activities. So I will not go into the details of the research methodology. Basically, if you want to have a key performance indicator defined, so you need to have the objectives defined, have a standardized data collection, and have a minimum sample size, and account for the exclusion inclusion criteria, and plan for continuous activity. So what we have done is a sample of 1 month reports based on this questionnaire CatQuest 9SF, and basically 2 categories, the symptoms from the patients and the patient activities and lifestyle. We collected the data in the form of a Google form and graded according to the patient difficulties, and these were the findings. So in 1 month, say 45 patients, so this is the patient requirement, and what really surprised us was the numbers. So the 87% were completely satisfied about the outcome based on their activities, except for a few patients who had dry eye or diabetic macular edema. So the conclusion is 87% were happy in all aspects of vision, quantity and quality wise, and 96% were satisfied when there is spectacle-free vision after cataract surgery, and that is the reason why we went on to adopt trifocal or EDOF lenses for many of our patients. And so these were the recommendations based on that particular month, and the impact of audit for patients and impact of audit for hospital is patient reported outcome measures is very important, and it's going to be the new key performance indicator for many of our activities. So this is how it is planned. So closing the loop, so if you want to improve your quality of services, you need to use KPI for improvement, and also compare the benchmark with other hospitals based on anonymized data. The companies will or accreditation agency will be using these indicators for benchmarking our country's requirement. So implement, review, keep learning from the KPI and celebrate the success. So not everything that counts can be counted, but what's really counted, literally count in terms of patient satisfaction and experience. Thank you so much.
Thank you, Dr. Nirmal, for wonderfully encapsulating what all you need to look for. Cataract surgery, as far as we are concerned, is a surgery, and probably for a long time we only thought of one result, which was what was the vision, corrected or uncorrected. But as you said, it is an experience. You have to be on the other side and realize it's actually an experience which the patient undergoes. And there was one slide where you had talked about things other than endophthalmitis and vision and stuff. So patient, his experience, how comfortable he was, how much he was apprehensive, or did he feel pain, not feel pain. These things are all something which are totally ignored. And the last point in that slide was whether you'd really recommend this to others. So that is a result. So that one slide probably encapsulated what all for all these young people out there. When you're going and starting your practice, that is probably the only thing which matters ultimately. Doesn't matter what machine you have, what surgery you do, anything. Only thing which matters is every patient walking out, whether he'll refer another patient. So thank you so much, sir. Anybody has any doubts? Murali sir?
Thank you,
I think
Sriram.
applying quality standards to outcomes in whatever procedures we do, I think it's a very important aspect of practice. It's not just visual outcome, it's not just intraocular pressure results, or it's not just the retina being on. I think these parameters are very important as we go on in our practices, and we'll find that increasingly auditing, especially quality audits, are very, very important.
No, it can be used to improve ourselves.
Service,
Our
yeah.
quality of, see, basically we concentrate on the surgeon's parameters. But unfortunately, 90% of the time, the patients are with the staff because their orientation is totally different. So this is what these type of indicators will catch up, and that will help the organization also.
I learned something, KPI.
Thank you.
Absolutely. We learned a lot of things, Nirmal.
Thank you so much.